welcome to Project Pulse Winnipeg's radiology interview. My name is Vicky and I'm the Professional Relations Director for this year. Before we begin with the interview, I'd like to thank our professionals for taking the time out of their busy schedules to sit down and share their insights and experiences with our audience. Could you first please take turns introducing yourself to everyone watching?
Sure. Thank you, Vicky, for inviting us to the project. I'm glad to be here. I'm Dr. J. Shankar. I'm one of the interventional neuroradiologists at the Health Sciences Center, and I'm a professor at the University of Manitoba as well. Thank you.
Thanks, everyone. Thanks, Vicky, for inviting us. So my name is Dr. Yi Yan. I'm a PGY4 radiology resident at University of Manitoba right now.
Thank you. My name is Esther. I'm a fourth year radiology resident here at the University of Manitoba, and hopefully being done soon. So
thank you so much. So before we begin, I'd like to introduce Project Pulse Winnipeg. So Project Pulse Winnipeg is a branch of the nationwide youth-led initiative, and we strive to familiarize high school students with the world of health sciences. We are a nonprofit organization, and we are composed of both high school and early post-secondary students. And through our conferences and online platforms, we connect students with professionals, university students, and other distinguished individuals, just like the professionals we have here today. So do you have any questions about us and what we do? Okay, so great. So the first question is, could you please provide more details on exactly what it is you do? And you can just answer this in any order.
Yeah, I can go first if that's okay. And I'm a radiologist, neuroradiologist, and interventional neuroradiologist. The way I explain is I read CT scan and MRI of the body, and being a neuroradiologist, specifically I read CT scan and MRI of the brain and spine. And I'm also interventional neuroradiologist, and that means that I do intervention, I do treatment, X-ray guided treatment, and that is, to be more precise, I treat stroke and brain hemorrhages. And that means a stroke happens because of blood clot. So I go inside the blood vessel of the brain and fetch the clot out to recover the patient. And I also treat similar other vascular diseases, aneurysms, and vascular malformation of the brain and spine. Okay, thank you.
I can go next. So radiology is a 5-year residency program, and that's after 4 years of medical school and then 3 to 4 years or 5 years of undergrad, depending on what kind of undergraduate degree you've had. So I'm in my 4th year, and in radiology residency, we do all of the imaging modalities, which include ultrasound, MRI, CT, and X-rays, which are kind of the main modalities that we have. And then within radiology, we kind of look at everything from head to toe. And like Dr. Shankar mentioned, we look at imaging of the body. And so we interpret those images and we give clinicians reports and have discussions with them about all the patients that we see. So part of that does include doing some procedures as well, and also being on call in the hospital in an emergency setting. For us in 4th year and 5th year, we're gearing up for our exams. So we're trying to really hone in on our skills in that perspective, and gain a little bit more independence as well. For me, I will be going to the States for my fellowship, and I will be specializing in the cardiac and thoracic region, which means the heart and the lungs. So I will be doing that.
Yeah, so we're a similar year as Esther. So we're both of us are 4th year in the residency training program. So basically, is like what Esther said, it's a program between the medical school and the attending physician. So I don't have that much to add, but for my plan is I'm going to do a MSK fellowship in Western University in Ontario. So like what I said what Esther said, usually we require 1 year additional training after 5 years residency. So, yeah.
Thank you so much. So the next question is, what drew you to your field and when did you decide that you wanted to be a radiologist?
Is this for all of us?
Yes, all of these questions are for all of you to answer unless I specify it's for one of you.
Okay, we can maintain the same order if that's okay, and or somebody else wants to go first.
Go ahead, Dr.
Go for
Shankar.
it, Dr. Shankar.
Okay. My story isn't as fascinating as perhaps Esther's and Ye's will be. I decided to become radiologist for very practical reasons. I didn't do my medical school in Canada. I did my medical school back in India. And the system there, it was a little different than here, but basic principles remain the same. And that simply means after medical school, I wanted to become a surgeon actually. So like everybody in my class knew that I will be a surgeon. I was very passionate for surgery. And after finishing medical school, practicality of life played a huge role in my decision making. To be a surgeon in Indian social circumstances, you needed quite a bit of money to establish yourself, particularly in the area where I grew up, and I didn't have that much of money. So I needed some subspecialty which can help me establish sooner in life, and radiology was the practical solution for that. So I chose radiology, and I could get radiology. Radiology was a very high in demand, and I could get radiology. Everybody said, okay, if that is your goal, choose radiology, because you could pretty much after a residency, you could become a consultant and you can start earning money. Well, that didn't happen. I became radiologist in the very first year. I wasn't very comfortable with radiology. And this is a very important thing for your viewers, Vicky, to know is one of the challenges with radiology is we don't have a direct patient interaction. A lot of us became doctor to treat patient, to interact with patient. And in radiology, we do not necessarily have that direct patient interaction. We predominantly deal with images of the patient. And that was a very challenging time in my first year of residency. And to the fact that I decided, no, I shouldn't continue in radiology. I should find out something else. However, more I dealt with radiology, I found out the interventional radiology, and where it's kind of the same system. It's almost surgery. It's a kind of minimally invasive surgery. And when I found out about the interventional radiology, I said, hey, this is a perfect combination of what my passion was for surgery and what the practical need was for me. And this was the reason why I chose what I chose. I became interventional. I focused on interventional radiology, and neuroradiology actually fell into my lap, honestly speaking, where I was training. There was a very good neuro department, and I said, okay, this is what I want to do. And I started with neuroradiology, and in India, if you go further in the training, you have to do neuroradiology, both diagnostic and interventional together. And I chose both of them, and that's where I am right now. Thank you.
Thanks, Dr. Shankar. I think what I find most amazing about just how physicians become physicians is just sometimes life happens and you kind of go into a path that maybe you didn't expect in the beginning. And that was kind of the same for me too, actually. I'd always wanted to be in medical school when I was young. I always wanted to be a physician. And I think part of that was because I wanted to help people. And I felt that medicine was one of the most amazing specialties that allowed you to do that. And so with me, I actually chose internal medicine as my primary choice of residency. And I did part of my training in Winnipeg. And then I realized how important radiology was during that time, and how I felt that internal medicine maybe wasn't the specialty for me. And I think although radiologists are kind of known to not interact with patients as much as an internal medicine doctor, for example, or a family physician who sees patients every day on a daily basis, but we do see patients and their pictures, their images, which is actually quite fascinating. Because you get to see something that a physician can't necessarily see with their own eyes or see with their stethoscope. They need an imaging modality to look into your body, and that's what radiologists do. And so I think I made a big decision to switch my specialties in the middle of my residency, and I'm really, really happy I did that. But it's a very, very intense specialty. You have to know a lot from head to toe, and you have to really understand the human body. And I think radiologists probably are one of the physicians that actually have an in-depth understanding of the intricacies of a human body that might be different from some of the other physicians. So that's how I really got drawn to it. I thought I would miss seeing people, but I don't miss it as much as I thought. And we do have interactions still with, we do small procedures. Dr. Shankar sees more patients than I would, because he does a lot of interventional procedures. But I think those small interactions are very meaningful. Patients are really scared when they come into the hospital. They're going through a lot of things, a lot of changes in life, a lot of big diagnoses. And I think radiologists, we're really good at calming people down in that very short period of time. And not a lot of people can do that. So even though we don't have that traditional patient interaction every day, talking with a patient, but those short interactions are really meaningful. And I think we really have that ability to make patients comfortable in really life-threatening situations. So that's how I kind of stumbled upon radiology, and I wouldn't miss it for the world.
In terms of when I thinking of to become a radiology resident, so I have a really long story to say, but I'll make it short. So basically, sounds like everyone has a little bit of tool to become a radiologist. So I also, like Dr. Shankar, I graduated from medical school in China. So basically, I didn't attend a Canadian medical school. So after I graduated medical school, I always wanted to be a gynecologist. But I came to Canada, and I had an opportunity to pursue my research career as a master's PhD student. So I spent many years in the research field. Then I became a sonographer. So if we have time, we could spend a little bit. If you guys are interested, we can spend a bit of time on what is sonographer. So basically, it's a technician position between the patient and also radiologist. So you perform the ultrasound, you obtain images, and you send images to radiologists for further interpretation. So I become like a technician kind of job for 5 years. Then I had opportunity to see people, have opportunity to see what is radiology like and how is radiologist daily life looks like. So I kind of really interested in to become a radiologist. But my choice at that time was pretty limited because as a IMG, like international medical student, a lot of program does not open to IMG students. So my thought was like, because I have a background for pathology, doing the research training. So my first thought was probably I can become a pathologist. That's probably a realistic goal for me at that time. But I was super lucky for the CARMS interview and match system. So at that year, there's one match spot. So they actually offered to me. So that's how I become one of the radiology residents. So I think the one thing is like what Dr. Kim said, you have to be prepared. You have to know the information. You have to know what kind of things you like. You have to try it out. But sometimes people like me, if you have limited opportunities, you may want to just have a backup plan. If you can't really go to the first choice, you may have to think about second choice. That's my lifelong learning teaching. You always have to be prepared. So but thankfully I got lucky. I got into what I want, basically my first choice. But if not, maybe today I'm a pathologist, I guess, because I had both interviews for both programs. But yeah.
Thank you so much. I think that was really good advice that you mentioned at the end. And I also think it was really interesting that all three of you, like radiology wasn't your initial first choice. I feel like a lot of people feel like they have to just know what they want to do in high school and then stick with that plan. Otherwise, it's like there's a lot of pressure not to stick with that plan. So the next question is, what is the most difficult decision you had to make in your journey that got you to where you are today? So this could be maybe you had to choose between your work life and your personal life, or maybe you just had to make a decision about how you treated the patient and it was really difficult. So something like that.
That's interesting. So I think when I look back, I think there were two important decisions that I made, which brought me to where I am. As I mentioned, the very first decision was to pick radiology, almost against my own passion. So that was a huge decision, which I don't regret afterwards. And the second biggest decision in my life was to leave my home country and come to Canada. I came to Canada hoping to only do a fellowship and go back to India. But the country and the system was so good that I decided to stay here. I had no initial plan to come here to settle. So this was a second huge decision. And both of them I don't regret. So those were not very easy decision. And Vicky, for your audience, I don't think they may have to make that second decision in their life. Hopefully not. But the first decision is always there, to pick radiology or as their subspecialty. One thing that I wanted to add about radiology is what we call radiologists are not doctors to the patient. Radiologists are actually doctors to the doctors. So we help other doctors see their patients, and the other doctors see their patients much better through our eyes or our work. Thank you.
Yeah, I completely agree with you, Dr. Shankar. That's a good way of putting how radiology works. So if you want to deal with doctors, do radiology, that's for sure. For me, I think I kind of alluded to it during my story, but the decision to change specialties was a difficult one. But like you mentioned, life happens, and it kind of puts you in paths that maybe you weren't expecting, or maybe you didn't want to go, but things always do work out at the end of the day. They really do. And so for the viewers, I think, everyone in medicine, all three of us, even in this room, all of us maybe are a very type A personality, which means you like things planned. You don't like going off course too often. You like things to be kind of, you have a plan in your head and you want to follow that plan. And when things go off of that plan, it's very uncomfortable. And so I'm definitely one of those people too. But as I go through my training, and as I become older, you realize that life just takes you in places that you don't necessarily expect. And that's actually okay. And it's totally fine. Some people do go through life like very on course. They go from A to Z really easily, but not everyone, and not most people. And I think sometimes that's for the better. You do grow, you learn, you really mature through those experiences, even though they're tough. And so I think for me, that decision was really tough. It delayed my training and me finishing my residency. And also thinking about being a female in medicine, having a family, and doing other things in life that are outside of medicine. So, it kind of delays these things, but I think at the end of the day, things all work out, and I'm very, very happy with where I've ended up so far. So I would just encourage everyone to really, it's okay to go through some bumps throughout life?
So for me, I think the most difficult time, if I think right now, I think there's one time point during my PhD training. I have to kind of ask leave of absence to, get the ultrasound training and become the ultrasound tech subsequently as a full-time position. By saying that, that means I have to give up a PhD, which is a very tough position. But my PhD supervisor actually stated to me, when you think about long term, if you don't have a PhD degree, your choices are very limited. Like, do you want to become a technician for the whole rest of your life? Or you want to still do something else? So at that time, I don't know. I think it's quite painful if you want to keep both positions, because you have full-time job, then you have to, to continue as a PhD as the part-time student. So that means you're going to be 7-11, you're going to have no weekends, no evenings, because I have family, I have kids too. So it was quite a tough decision. But when you think about long run, I'm glad today, if I don't have a PhD degree, I probably won't be able to get into a residency program. I think the chance for me is zero. So that's why I say to you guys, I think when you make a decision, I think you have to think about long run. When you only think about whatever happened right now, I think it's tough to know if it's right or wrong. But when you think, like for a long time, think about what kind of effect you're going to have for the whole rest of your life. That's more important. The other thing my supervisor taught me is learning is a lifelong thing. You can't just give up learning at any stage. So no matter what you do, even for now, we're resident and Dr. Shankar's staff, I'm sure all three of us still learning every day, trying to learn from your mistakes, trying to read stuff. So I think that's the other thing I want to point out.
Thank you so much. And I really appreciated what you said, Dr. Kim, about how it's okay to face bumps and face changes, especially since I would say I'm very much a type A person as well. So our next question is, what do you think is the most difficult aspect of being a radiologist?
I think I alluded to that at the beginning. It all depends upon how you look at your career. What do you want to do? So when I wanted to become a surgeon, and from surgery to radiology, that was a big change. So that was the biggest issue with me. Most difficult part was that I was not able to see patient directly. And this was one of the challenges, because I didn't have much exposure to radiology during my medical school. All that I had was, I think, a month of radiology rotation, focused radiology rotation, and then here and there exposure about radiology. Perhaps that was the biggest reason. I didn't even know what radiology is very well before I got into radiology. And once I got into radiology, once I knew the different aspect of radiology, then I was very comfortable. And above all, when I had that philosophical concept of being the doctor's doctor, that made me even better. Like, I felt super good that, oh, this was the perfect decision I made. Now I don't think I have any difficulty in being a radiologist. Thank you.
I hope we reach that level of confidence, Dr. Shankar. As a resident, I think I think the difficulty is, which is normal, is just the continual learning and the amount of things you have to know. I mean, that's the same for a lot of different fields, but I think radiology can be very tough because we're one of the specialties that deal with patients head to toe, and that's literally from head to toe. So I think that's probably one of the toughest parts. I think at the end of the day, you get through it. You try your best. You give it your all. You study hard, and it's enough at the end of the day. But you feel like it's not enough as you go through it. So hopefully one day I have that confidence like Dr. Shankar.
So I think to me, the most difficult aspect for radiology, I was going to say, you learn from mistakes, because, we make mistakes every day. It's quite challenging. You kind of, how can you, what kind of attitude you have for those mistakes, because it's kind of, it's hard to, it's inevitable for not making mistakes in radiology. We miss stuff, we overcall stuff, even as a staff. But as a resident, we tend to make a lot of mistakes, particularly during your call, particularly during your daily readings. So how are you going to learn from your mistakes? I think the positive learning is very important for us. Otherwise, you got beaten up every day, and it's not going to go well in the end. The other thing I was going to mention is a difficult, challenging part for radiologists: multitasking. As a medical resident, you're on call, you're so busy because the volume is high. You have to read a lot of studies, but at the same time, you got interrupted by a technician, interrupted by the other multidisciplinary teams, such as a surgeon, such as the other neurology staff. So they want to review the images, and also you have to cover multiple hospitals, multiple services. So sometimes you feel like you're fighting you're just like, you have no downtime. So that's the other thing we have to manage on a daily basis. It's quite important for us to do multitasking and to deal with high stress kind of workload. Those are two things I think it's challenging for radiology.
Thank you so much. And while we're on the topic of like multitasking and managing your time, do you guys have any advice on how you can manage your time properly and like prioritize what's important?
I don't think there is a fixed rule that can fit everybody. The bottom line is, like if you want to get to a certain point to achieve a goal, you have to work hard. Irrespective of what stage of career you are. I work with both Yi and Esther, and we definitely are in slightly different stage of our career, but we all work very, very hard, and much harder than a high school student could even imagine, I should say. When I was at that stage, I never knew that I had to work so much. There wasn't anybody around me who could even tell me how much we have to work. But the biggest thing is, once you are passionate about something, once you know why you want that, you know what, all that hard work becomes so easy. You start enjoying the process, and then it's just a piece of cake. So don't worry about that. Key is to remember, as Esther said, I think he said, it's lifelong learning. As long as you are ready for it, this is yours. Thank you.
Yeah, I completely agree with Dr. Shankar. It all comes down to, and time management changes, your skills change as you kind of go through life. And then priorities change too, as you go through different stages of life. So it's okay if someone is prioritizing A over me, because right now we're in different life circumstances, but it's hard not to compare yourself with people. But I think at the end of the day, it comes down to really knowing what's important to you, and then working hard to get to where you want to be. And that's different for everybody. So, but I do agree with Dr. Shankar, like the heart, I think a lot of us talk about being hardworking, and that means a lot of sacrifice of your time, and time, like personal time with family, and time that you would like to have traveling, even, things like, so there's always a balance between where you want to get to and where you are now, and but again, I think that's different for everyone, and that path doesn't have to be the same. But I think, in medicine, and I think most subspecialties in medicine require that sacrifice to a certain degree, and without it, I think it's hard to get where you want to be. So that is a part of the reality, I think, of the job.
Yeah, I totally agree, both of you guys. So two things. One is prioritize things. The other thing is sacrifice things. So I don't have too much to add, but I was just saying, I just encourage everyone to try it out. If you have a situation you have to do multitasking, just try it out to see how you feel. Sometimes it's just a practice. If you have to do that many things in a certain amount of time, I'm sure everyone can do it. You just practice and get better next time. That's what I want to say.
Thank you so much. I think all of you provided very good advice. So our next question is, what advice would you give to a high school student who's passionate about the health sciences, but unsure about which field they would like to go to? And I guess as another question is, when you were in high school, did you have any idea of what you wanted to do in the future?
I think I feel the generation gap. And Vicky, at your stage, the fact that we are even talking about what we are talking about wasn't available at my time, not at all. In high school, I barely even knew that I want to become a doctor. And radiologist, no way. I didn't even know what radiologist is in high school. So I think that's just partly because of generational gap. And all I wanted to tell you is I did not know what I wanted to do. I did not know where I would end up being. And it's okay. It's okay. It's very, very okay not to know that. Even I don't know where I will be in 5 to 10 years from now. And when you don't know about so many things, it's a good thing actually, because it will be so different than what you are, where you are right now, that you cannot even know. It's good to know, to have what you want to do, but you don't necessarily have to know that. You take one step at a time. We can only plan for something that is in your sight, and beyond that you can't, and it's okay. It also depends upon what kind of family background you come from. Some families are very accomplished families, so there could be parents or some relatives who can explain things to you, how things work in the future, but others don't. I didn't have that privilege. I grew up in a very, very underprivileged, both socially and economically underprivileged environment. And I came to this place, and it has been a long journey. There's no way we could have known this. So, and it's okay not to know. That's I think to the high school students, I would say that it's very important to know that it's okay not to know. And it's a long journey. Just keep running, keep doing the right thing and good thing at your stage, and you will get to where you will be.
I think that, and I agree with Dr. Shankar, it's, you just never know where life is going to take you. But I think, anyone who's interested in health sciences, I think there are a couple probably common denominators amongst people who want to go into like health science field is, they probably generally like the science kind of topics. It comes easily to them. They enjoy it maybe more than some of their peers. There's also probably a common denominator where you feel like you want to help people to a certain degree, but within health sciences there's a ton of different types of fields. So I wouldn't necessarily limit it, but for me, I grew up as an immigrant child. My parents immigrated from South Korea, and it was post-Korean War. It was a third world country. They had no money. They came with nothing to Canada and built a life for themselves. And I think education was a really important factor for them. So they really instilled education in my sister and I. And so I think that's really a quality that I'm very privileged and very thankful of. And so I think that's a part of me wanted to really contribute back to society, because I had received a lot of good things from Canada as an immigrant, which I think is, I'm very privileged. I'm very thankful for that. But does it mean that you have to be in, the classic, I did all my sciences in high school and going into the faculty of science and then going to medicine, and I don't think that's necessarily true, because I think a lot of young people now have a lot of very interesting skills. It's a very computer focused, smartphone focused kind of generation. There's a ton of things that you can learn. And even within medicine, it's not just science. We need leaders who are good at leading others. We need people who have a business kind of side to themselves. We need people who are good with computer science and coding, you know. And so I think, like, as a physician, it doesn't necessarily have to be a traditional path to that field. If, let's say, you like science, but you also have another interest in something else, I think that's fine. Go for it. It's totally okay to explore. It's totally okay to kind of look at what your true skills are. You don't have to go in a classic route to medicine at all. And I think there's just so much more out there than health sciences, but it doesn't mean you can't do health sciences. There's just lots of routes to get there, which is contrary to what we believed when I was going through school. The belief was you have to do science, you have to do an undergrad degree, then you have, maybe you have to do a master's or a PhD or whatever, and they get into medicine. But I just don't think that's the case now, because even within medicine now, there's so many people with so many different skills, and that's always an additive thing. It's never a minus. So that's what I would recommend.
So for me, I think nowadays, I think you guys have a huge advantage compared to our old generation. The information you guys have right now is tons, right? So think about that. We don't have any opportunity to know what is radiology, what is any subspecialty in medicine. So in terms of that, I think the information is good, but at the same time, you have to think about what kind of special field is suitable for me. So in terms of that, I think medicine, like what you guys said, it's a broad field, right? So you can, for people who has good hands, like Dr. Shankar, you may think about surgeon. But if you have, by chance, you have radiology, you can have a good combination to do neuroradiology, just to put things together, right? So that's what you're good at. For me, I know I have a good hands too. That's why I went to sonographer, which is ultrasound technician. You need good hands. You need to have a good hand-brain coordination. That's what we say. Because otherwise, if you don't have a 3D in your mind, it's hard to do that job, right? So if you have research, you have interest in research, you may want to find a field require research, like a surgery. I think they have a master's degree for research, or the other neurosurgery. They're heavily based on the research. If you don't like research, sure, you can do something like more clinical work, more things doesn't require research, right? So it depends on what is your interest. So you have to try things out. You have to keep the curiosity. If you are interested in certain things, just get a job shadow to see how you feel. I think interest is your best friend, right? So if you have no interest, sure, I'm sure I'm not touching this field. But at the same time, you have to realize your limitations too, right? So put your strengths and limitations together and select the best field for you. I think that's what I would do. But before doing that, you have to try. Again, you have to, get a job shadow, or get people to ask, or just see how it looks like. Every single field has a cool stuff, I would say. Radiology, of course, they have a lot of cool stuff. Surgery, I'm sure you guys had a panel, surgeon panel. They will say, oh, there's a lot of cool stuff in doing the operation, right? So there's no good or bad. You just have to see what you're good at it, right? So.
Thank you so much. So our next question is, what is one lesson that you have learned that has greatly shaped who you are as a professional or person?
If I have to put it as one, then again, very simple thing. Do your best in the job you have at hand. And that will open up everything else in the future. And I think that's very important, because that's the only thing that you have under control. So do your best in the job you have at hand.
Yeah, mine is along the similar lines. I think hardworking ability is something that people can't take away from you. Like, it's something, like Dr. Shankar mentioned, it's something that you can control, something that you can put in the effort, you can put in the time, you can put in the passion, and nobody else can take that away from you. And so I think, and that's gotten me very far. in life. I think it was instilled in me by my parents, who were very hardworking. You know, immigrants work very, very hard to establish a life here in a foreign country when you have no resources, nothing. You don't know the language, you don't know the culture. But I think watching my parents and growing up in that environment has just naturally allowed me to be hardworking and to go for things that allowed me to advance far in life. So I think that really is my advice. If that's a trait that you don't think you have, it's something that it can be developed. It's not something that that you can't develop. So I think that would be my advice.
Yeah, similarly, I think hardworking or lifelong learning, that's my advice. So overall, you guys have huge advantages in your younger generation, but still a lot of time you have to work hard and just keep learning.
Great, thank you so much. So next question is for Dr. Kim, and it was, what was your experience like in high school and medical school? For example, which classes did you take and how did you do in them? And what were some of the things you did to prepare yourself for medical school?
Yeah, thanks for that question. So I graduated from high school and undergrad here in Winnipeg, born and raised in Winnipeg as well. So I guess I'm a Winnipegger for life. But in high school, I took the normal courses that you needed to take. I probably focused on the sciences at the time because I thought that was what I needed to get into, a Bachelor of Science and then into medicine. I don't necessarily agree with that philosophy at this point in my career, because I think that there's high schools now have just so many interesting classes. There's so many things that you can learn outside of the traditional. If it's something that you're passionate about, like you love biology, you love chemistry, you love physics, do it. Absolutely do it. But you don't have to limit yourself to that. I wish I took more world issues classes, like politics, social sciences. I didn't have that much flexibility in my high school curriculum to do that because I was so focused on going into medicine. But I think, that's actually, I might not be here if I did that. I might have done law or something instead. But that, that's something that I actually was interested in, but I didn't have the flexibility to do that. And the same happened in university. As if you pick a specialty, you're engineering or business or science, you kind of have a set number of courses that you need to take. And then you do have a couple of electives, but most people choose to do more courses related to their field, which I think is okay. I think the system doesn't allow for as much flexibility as there should be. But yeah, my grades are very good in high school and university. I mean, classically, I guess we're all kind of supposed, you're told that you have to get all straight A's. So that's kind of what you aim for. But I think it's not necessarily that it's not about the IQ that necessarily gets you these marks. It's really, I do think that it's my hardworking ability. And if there was something that I wasn't good at, then I tried to, I talked to the professor, or I talked to my classmates, I talked to people who are senior to me, how can I get better marks in this class? How can I prepare for this exam? How can I do better on this lab, etc. So I think part of it is being smart at finding who can help you get where you want to be, because there's nothing wrong with asking for help from other people. So because I received a lot of help from my seniors in undergrad, I created a network where we could help my juniors, be effective and be efficient in their undergrad studies, particularly those people who want to go into the health sciences, such as medicine or dentistry, pharmacy. I think having a good network of people around you is important and can be very helpful throughout your training, not just in high school or undergrad, but just throughout your life. And of course, mentorship as well.
Thank you so much. And our next question is directed for you again. And it is, did you have any volunteer or lab experience when you were in high school? And whether you did or you didn't, how do you think students can gain it right now? And I guess as a third question to this could just be open to any of the professionals, but it's, should students feel pressured to gain all of this experience in high school? And if not, how can they try to gain this experience?
Yeah, so I didn't go to any labs in medicine. I did like in high school, I didn't pursue that. I actually pursued a lot of leadership opportunities. I was on a lot of sports teams in high school, and I was very involved with my community, my Korean community. So I just didn't have time to do that. I think, you know, but I knew that leadership was a passion of mine. So I tried to pursue those things. I think if you are really interested in working in a lab or trying to get connected with somebody in medicine, and that might not necessarily be to advance yourself, but to really learn about the field, to like understand, is this for me? And we have to remember that each lab is different and each research is different. So it might not be a true reflection of what you want to do in your career. So I think you have to remember that as a high school student and as a university student. I think there is a conception that you need, a lot of research experience to get into medicine. I think that's partially true. I think, but if you develop things, again, like you have other kids these days, I feel like they have a lot of different passions. And it's like, let's say you're super into coding and you're like, I don't have time to do research. I think that's fine. But you've developed a skill that other people don't have. And if you're able to kind of utilize that in other ways, I think that's totally fine. If you have leadership skills or you have sports skills, you're a high performing athlete or a musician, these things are absolutely important too. So I wouldn't give those up to do a research or like do a lab work that maybe you're not as passionate about. So I think that I don't think you have to do lab work to get into medicine, but to demonstrate a proficiency skill in a field that you might be passionate about. So if you're really good at something, capitalize on it, advance it, work on it, improve it in high school, in undergrad. Because I think through that experience, you gain a lot of skills that can help you in medicine in the long run.
Thank you so much, Dr. Kim. So our next question is for Dr. Yan, and it is, what are residents and when do you go to residency? And another question is, I remember you talking about MSK fellowship. So could you kind of just talk about what fellowship is and what MSK fellowship is specifically?
Sure. If you don't mind, can I share my screen? I just had I think Dr. King has also mentioned a bit about what is residency, what is radiology residency. Also, Vicky, can I share my screen, because here says host.
Oh yes, I will give you co-hosting permission so you can do that.
Yeah, I'll be quick.
Let me know if you can. Okay, great.
Can you guys see?
Yes.
So basically, so residency, particularly radiology residency, like what Dr. King already said, it's between medical school and attending a radiologist like Dr. Shankar. It's a transition time or period. So I'm just going to say what does a resident or radiologist do, and what a typical day might look like as a radiologist or resident. So so here, first of all, it's just residency. There's three types of things you could do for a typical residency. So usually radiology residency requires 5 years. So first year is a clinical training year, and from second to fifth year, usually you require, rotate through different departments. And the last year you are supposed to take Royal College exam. That's how you became a radiologist. A lot of people taking one year additional to get a subspecialty training. That's what we say, fellowship training. So Dr. King is going to do a thoracic radiology training. I'm going to do MSK, which is looking at the bone and muscles, basically. So you can say bone or muscle doctor in
lay terms. Is that
yeah,
what you mean?
exactly. Yeah, thank you. So, and Dr. Shankar is a neuroradiologist, which requires 2 years additional trainings, because after you finish 5 years, for certain field, such as neuroradiology and neuro interventional radiology, require 2-year additional training. So that put the whole total training year to 7. So some people give up the additional fellowship training year. That's why you end up with 5 years training. So you become a staff radiologist. So basically, there are 3 different type of route you can choose. If I made that clear. So basically, in the end, you have opportunity to become a general radiologist after 5 years, or become radiologist, get a subspecialty in thoracic, in abdomen, in MSK, or in neuro. That's additional 1 to 2 years in summary. So total requires 5 to 7 years training, if that makes sense, before becoming a staff radiologist. So in terms of what does a radiologist do in a typical day, so I actually took some pictures from the website. So typical day, we started from like 7 o'clock or 8 o'clock before your staff came in. So we grab a list of studies, then we just read out by ourselves because we have PAC system. That's what the picture showed. Then you make up your own report. So your staff will come in and they will choose to review a couple of whatever time they want during the day. So you're going to sign out your report after you're reviewing with your staff radiologist. And also the other significant part for radiology training or residency training is you're doing the rounds. So we have 3:30 rounds. So you discuss the case in front of the other colleagues and also whoever in charge of the rounds, who is usually a staff radiologist, has a subspecialty. So the topic you discuss every day would be either MSK or chest or abdominal neuro. So as Dr. Kim alluded before, we're also required to be on call duty. So that's how we on call. So basically you're running your own show. So you are the only one doing everything. You are controlling the whole department, which is good. It's kind of a good exercise or good training before you become a real staff radiologist. So basically you can do whatever you want, but it's quite busy. Sometimes you don't even have time to rest or to go to washroom. So and also the other part, exciting part for some of the radiologists, such as Dr. Shankar, you get opportunity to do a case in the mini OR, help the stroke patient or help to the other, aneurysm patient. So I think that's the other exciting part for radiology. You get the chance to do a little bit both. Some people, if you like chest medicine, you can become a chest radiologist. If you like gynae, you can become abdominal radiologist. So I think it's a very good combination. You can even have a direct patient contact if you do intervention or if you do ultrasound. I'm sure you do a lot of patient contact. I hope I made that clear. So I'm just stop sharing my screen.
Yes, thank you so much. And thank you so much for preparing a slideshow. I feel like that diagram you provided was very helpful and it helped me understand everything. So our next question is for Dr. Shankar, and it is, what are the biggest challenges you have faced in your research, and how has it been impacted by COVID, if it has been in any way?
Thank you, Vicky. I should have told earlier to your audience that 40% of my life I officially spent in doing research, and in real terms, I think I spent 60% of my time doing research, 40% doing clinical work. And research is very, very important. And again, if I can relate to your earlier question, did I know in my high school that I would do research? The answer is no. I didn't even know what research is in high school. You guys are really privileged to know a lot of these things upfront. So research is very, very important. And my kind of research is all clinical research. So whatever E explained to you, different aspect of radiologist work, I pick my interest among all of those, and I start doing research. The way I put research in is, when I do my clinical medicine or I do interventional neuroradiology, I help one patient at a time. When I do research, my work has the potential of helping hundreds or thousands, could be a million of patients at the same time. And this is such an important way to understand the value of research, because most people feel that, okay, whatever research we are doing, it may not even see the light of the day. That is not true for clinical research. Most of the time, whatever we do in clinical research get reflected in daily practice very, very soon. And um, and this is very important for me because I didn't have the proper research background when I started. And soon I found the value of research, and I trained myself, or I equipped myself to do more research. So your question was, does it, uh, what was the biggest challenge you faced in research? Biggest challenge was to find research, actually. So once I found research, then it became much easier. One of the other bigger challenge in real life is find opportunity to get paid to do research. And that's very, very important in clinical world, because most of the time we get paid to do what we do. And when we there are fee codes for everything. And when we read a CT scan, there is a government decided fee code that we get paid for that. When we do research, there is no fee code for that. Right? And if I do, as I said, I do 40% of my official time I spend doing research. That means either I get paid less, which I do, but that's okay. But you don't want to get paid only 60% of what your colleagues are getting paid and do follow research. So that's another bigger challenge, is to find an opportunity where you can get paid to do research. And that is very, very important. And it's important for both E and Esther to know that when you become a staff radiologist, that's the time to negotiate with your partnership that you want to do research and how much support is there for doing research. And of course, you have to balance it to your passion, okay? How much passionate you are to do in doing research. If you are, show your potential employer that I can do this because of my background. And most radiology group or most clinical group are interested in researchers these days, so which is a good news. You can find research opportunities very easily. Not super easily, but you can get it for sure. So that's the most important thing. And that other thing about research is, you are always at the cutting edge. You know things well before any of your colleagues will know what's coming in the future. And some of that, if you're very good in what you're doing, you may be the one who is creating that future opportunity. And that can put you in the seventh heaven. So you feel that, oh, this is what I created. And that I think that is the most important feeling that a clinical researcher can have, when your own research changes the way medicine is being practiced. The second part of your question was, I think you asked me about COVID. Yeah, COVID affected everything. So COVID affected mostly in negative way, but there's always a silver lining. So COVID delayed all of my projects because most of the time my research support staff were not allowed to come in the hospital during COVID time. So they had to work remotely. And there are only so many things you can do in clinical medicine from home. So things were getting delayed. Other research processes were also getting delayed for the same reason. But the silver lining for that was that gave me my own time. I didn't realize I had so much of time in life till COVID hit. So I think I suddenly felt that my time has grown twofold, if not threefold. And I really used that time to do a lot of things that I didn't even think that I could do. So that was the biggest advantage of COVID being around. And now I have to, now that the COVID is phasing out, it is at at work. I have to go back to the reality that, oh my goodness, my time is getting away from me. COVID helped us this, the Zoom meeting, so virtual meetings. So this is a huge time saver. Imagine in a real world, I don't know if it was this panel interview was there before COVID, and if it was there, I'm pretty sure it was in person. And Esther is in hospital right now. She would have not joined the meeting if she had to join the meeting on this day. So COVID helped in this, and this has saved us time. I used to travel every single month, nationally or internationally, for my research projects. And now I don't have to. I just sit in my office, spend an hour or two over Zoom, and the same work is done, which is amazing. It was unbelievable. So that has saved a lot of time, and it has increased efficiency. So on one hand, where COVID has slowed down things, on the other hand, COVID gave us or enabled us with tools that were not used before to increase efficiency. So I would say it's a two-edged sword. You use it to your best advantage.
Thank you so much for providing us insight about like research, and I'm really glad that you were able to find like a silver lining within this crazy time. So this is probably the last question we have time for today, and it is, what do you think is an important quality or skill that radiologists or researchers should possess? And what skills do you possess to make you successful in your career?
Well, I don't know if you know about Canadian Institute of Health Research. One of the president of Canadian Institute of Health Research was presenting one time, and I was in the audience, and one of his statement got stuck to me. And I think that's the most important skill researchers should have. And that is, we have to be pathologically optimistic. Oh. And what that means, to achieve anything, we have to be optimistic to get that. And to be a researcher, even when you are failing, even when you're doomed, actually, you should find some optimistic thought or pathway that can take you further. So to be a researcher, and this applies to any field of research, you have to be very, very optimistic. So much so that your colleagues or your friends may laugh at you. That's okay. Don't worry about it. This is the only skill that will take you further. Otherwise, research, to many people, research could be very boring, very laborious, not knowing what is at the end. But that's the fun part. That's exactly why we do research, because we don't know. If we knew everything, then we don't have to do research. To find something new, you have to be super optimistic. Of course, you have to stay hardworking, and that is the bottom line. But you have to be very optimistic.
I think for me, it's an intense calling almost in the field of medicine. It's a tough, long road, and you don't really realize that when you're younger. Not counting high school, but just undergrad and extra studies and residency and fellowships. It's a 15-year road that seems endless. And maybe at the end of training, it's 15 or 16 years, but like Yi and Dr. Shankar mentioned already, it's lifelong learning. The learning never really stops. And I think it's hard if you like to see things right away and you like to have immediate gratification. So I think that calling to be in medicine, to be a physician, it's really noble, of course, but it is a long road that can be tough sometimes. So I think and in combination with the hardworking skills that we talked about, and the passion and all those other skills, like in combination, I think that's what really drives me forward. And at the end of the day, when you see, even if you see one patient that gets better, it really takes away all of the difficulties that you've gone through. To know that you've made an impact in someone's life in a moment of their most difficulty and desperation, I think it makes it worth it. But it is tough. It is tough. It's not an easy path. But I think at the end of the day, we're able to help patients, the majority of patients, and really make an impact in their lives. So I think that's what really drives me.
I think to me, I think to how to learn from your mistakes. So the learning from your mistakes can apply in any field, not only in medical field, non-medical field, in your family life. So, you know, I made a lot of mistakes in my life, but I'm still, you know, learning from the mistakes, right? So I argue with my wife, I learn any single arguments, you know, while we argued. In medical field, we make mistakes every day by reading studies. So just like you have to learn from it. And also the other stuff also applies. So I hope that's one thing we can deliver today is just learning from the mistakes.
Thank you so much. I feel like everything that all three of you touched on was incredibly inspiring and like informative. So as I said, that is the last question we have time for today. So on behalf of Project Pulse Winnipeg, thank you so much for sharing your valuable experiences and perspectives and answering our questions with such insightful and truly thoughtful answers.